Good morning, everyone. Good morning, healthcare professionals. Thank you for joining us today to cover the state of Nevada's Sentinel Events Registry and the REDCap reporting platform. I'm going to now share my screen. My name is Jesse Wellman. I'm a biostatistician 2 with the state of Nevada, Department of Health and Human Services, and I administer the Sentinel Events Registry. The Sentinel Events Registry is the reporting of events that should never happen in a healthcare setting. The NQF defines these results, the reportables, and that is the guidance. So in 2019, Senate Bill 457 was passed, and that expanded the number of facilities that are expected to report. Previously, it had been ambulatory surgical.
Jesse, you switched to being on mute.
It appears that I have become muted, and I will try to pay attention to that closer so that everybody can see. Sorry for that hiccup. We're working on it here. To resume our presentation, we're now going over the new list of facilities that are expected to report to the Sentinel Events Registry. And here are the list. It's expanded from about 3 to 4 facilities to, I believe, 16 facilities. And some of these facilities are referral or staffing or nursing pools. And if for whatever reason you feel that the reporting burden would cause a double reporting or is not appropriate to your setting, you're more than welcome to send an email to the ser@health.nv.gov explaining why you feel your facility type should not be either a participant or in a limited role. Excuse me. The other point with the SB 457 is the reporting now of a not natural death. And so a normal course of a disease would be considered a natural death, but someone drowning in a bathtub would be considered not natural death. So now we will go and look at the REDCap reporting platform. And before I do that, I'm going to paste in the chat the program's link. And if you have any questions, please put them in the chat section, and I will get to them once the presentation is complete. So now we're going to take a look at the REDCap reporting platform, which is where information is entered into the Sentinel Events Registry. When you first log in, this is what you will see, and you will click Login. And we have gone to a 2-factor email authentication system where you simply click this little radio button and then go over to your email and wait for the code to arrive. Under normal conditions, it should show up within 2 minutes. Just grab the code, right-click, copy, return to the REDCap interface, and click Paste. And it didn't copy it. It looks like it's got the URL. So we go back. Normally you have 2 minutes to get this information, but if for whatever reason you are consistently seeing a slow message, let us know and we can modify that time frame. So with my role, there are many projects, but with the Sentinel Events Registry, there are 3 main projects: the event reporting, the annual report, and the contacts. We will go over right now the event reporting. This is if you have a needs to be reported, and we will briefly go over that. So this is our frequently asked questions, and it's currently being updated. But at the very bottom here in the frequently asked questions is the list of reportable events. So we have things like surgery, invasive procedure, wrong site of the body part, wrong patient, use of contaminated drugs, device other than intended, device failure, discharge or release of patient to unable to make decisions, elopement or disappearance, suicide, suicide attempt, uh, self-harm, uh, falls and pressure ulcers are the number one and number two areas of Sentinel events reporting. And some of these events are reportable by simply occurring, particularly assaults and any sort of physical altercation, while other events have the bar of permanent harm. And what you need to do is go to the NQF website and research it yourself to determine which ones of these events qualify for permanent harm or simply occurring, determining that they need to be reported. So here we are in the RedCap platform, and we need to create a new event. We're reporting a new event. And so you would come over here under data collection and click add edit records. And for a new record, you would click here on the green rectangle button, add new record. And a Sentinel event reporting requires 2 aspects. The first part is the reporting to the state, and the second part is the root cause analysis, or where determination was made of how the event came to pass and what can be done to prevent it. So the notification of the state is the first part. And here you would put the date, and we're going to say we've put it in today, and the date of the Sentinel events, we're going to put that in, but we're going to modify it because it was actually on yesterday. And then our facility digits, whatever it is, your facility name, and the login name, and then your name. Now, what I just did is what you're not supposed to do. Your login name does not match who you are. We've had this problem in the past, so the login name should match your name, and the user login should actually be whatever it is. Now, this is important to enter this, and there are certain timelines expected to be met that are listed in the frequently asked questions. So we have date facility became aware, and we'll put that as today, and the date the state was notified, and that is today. And we ask for patient control number and medical number, but is not required. We ask for the patient's resident country and sex and birth date. We do ask for the birth date. It's not required, but it will tell us if there's been a mistake in the dates, particularly if they were born the day of reporting or after the event. And that has occurred in reporting. And if that does occur and we find it, you will be notified to make corrections. So we're going to pick a date. A while ago and just put that in there. And then this is important because notifying next of kin, family, significant other is a critical component of doing the right thing when it comes to a Sentinel event. And so when were they notified? And we're going to put this as today, and then the method of notification. Now, you notice in the fine print, if they expire or there's no family or significant other, leave blank. And then you would simply say not notified, hand delivered, faxed. In this case, we'll say we called them. Now, where did this occur? Which department in your facility? If you don't have a department, just choose the closest area that fits the appropriate place in your facility. And so we're going to say long-term care because we're going to call the event a fall, which is the #1 most common event. So interestingly, we have a pick list, and so it's fairly simple to stay and choose the appropriate event that you're reporting. And if for some reason you have an event that you think might be a Sentinel event, but you're not sure, you can follow 2 paths. One path is to enter it here and put a note saying, I think it's a Sentinel event, but I'm not sure, and then provide details. Or you can send an email to the ser@health.nv.gov saying, we have an event that we would like a determination to be made. Now, part of the SB 457 and reporting of non-natural deaths, we also ask this of any reason, whether the patient expired during their stay or within 24 hours. In this case, they did not expire. So we've completed these parts of it. This is for internal use only. And because of the platform, we're not able to hide this at this point. But so once you finish this, then you want to change the status from incomplete to unverified, and you can save and exit or stay on the form if you want. So at that point, we've created the notification of the state and the basic information around the Sentinel event. Then you have, I believe, up to 45 days from notifying the state to complete your root cause analysis. Those timelines are listed in the frequently asked questions. When you're ready for that, you would click here. Now, we will not notify you once we've reviewed it. You will notice when you come back in that the status will be green. So this area is when you've completed your root cause analysis. And then the event, but we didn't, what we're saying it was yesterday. And your license number ports right over, and then your name. And that's your login name. And in the schema we're using right now, include your first name, last name, and your license number. And then we put in your first name. And so this is the date that your facility completed their root cause analysis. And I've had people do this reporting the same day as the Sentinel event. And there is nothing saying you can't do that. It just suggests that the root cause analysis was either so plain or was not thorough. So the next part here is the primary contributing factors, and check all that apply. And they're grouped by kind of categories. So patient-related, staff-related, organization. And in the case of falls, a common one would be non-compliant or frail and unsteady. And as far as staff would be maybe failure to follow procedures. They were in an area of known high risk for fall, and they didn't carry a safety belt for patients. And these are just examples. Each situation is different. And to kind of sum up that part of it, we ask, what is the single most important contributing factor? And we will go with this for now. Now here, obviously not everybody has more than 4 departments. But if you should and think that there really is more than 4 departments, go ahead and put them in. We have no way of restricting that. But we do ask if you can to limit it to 4 departments. And then this is a pretty interesting part here. based off of your root cause analysis, should any policies, procedures, or processes be changed? And sometimes it's yes, and sometimes it's no. And in this case, though, we're going to put yes. And what that kind of follow throughs is, what are the corrective actions? Are we going to do a policy development or policy modification or a process review and things like this? In the past, I was concerned that the root cause analysis might not have been thorough, and per patient safety guidelines, particularly the Veterans Administration, which I recommend is a good source to look up how to follow best practice. How many staff were interviewed and how many non-staff were interviewed in order to determine the root cause analysis. And then a key component of your root cause analysis is informing administration, those who make changes to policy and procedure. And so we ask that you put a date in for when they were notified. And if there are corrective actions, what are they, and how are who's responsible for them? What are the timelines for review, and how do you indicate the implementation has been effective? And then we ask for lessons learned, and that's been fairly valuable to share on the annual report. Certain of the more common lessons learned are shared for others to gain um, some insight to head off potential issues. And similar to the previous report, when you're finished, change it to unverified and save and exit form. So that is what is expected when when a Sentinel event occurs and you need to report it. There are two other reporting requirements, one of which is open right now. From the first of the year to March 1st, your annual summary report is required, and this is required even if you do not have a Sentinel event. And the interface is very similar. You come over here to Add, Edit Records, and you click Add New Record, and this is the annual report. The year the event occurred, and in this case, we would say 2021, and then the person completing it. And if there seems to be a little bit of a delay, that's because this is through several different hops through a VPN to the local machine in the office from my telecommute situation with our current pandemic. So this would be the account of the person filling it out. The facility name, your license number again, and then the name of the patient safety officer. This is the most important key point of contact as far as the Sentinel Events Registry goes. And in this case, we're going to go with Scooby-Doo. So here is a matrix of the various Sentinel event types, and then just enter the number that occurred. And you can either leave it blank or you can put a 0. It's up to you. But at Scooby-Doo's healthcare facility, we did have some procedure complications, and we had one device failure. And we had one elopement. Somebody ran out of the lobby before we could get them all signed up. And so once you've entered all of these various Sentinel events, there's also the reporting requirement of the unnatural death. And then if you've filed an event and it was determined not an event. So some of the other requirements of the Sentinel Events Registry is that every facility has a patient safety plan. The chat, under forms, there is a template for a patient safety plan. That template is meant for a large institution, and we are in the process of reviewing to provide a template for a smaller institution. However, the information there is applicable anywhere as far as patient safety goes. And it's probably a good idea to at least look through it and then select the parts that are most appropriate for your facility. So along those lines, we ask, have you sent us your patient safety plan? And if you look right over here, there's this green arrow with upload file. And this is where you would go to upload your patient safety plan. And we're asking that you upload two versions of it, one with your facility's names of staff who are responsible, and one without names. This information is packaged up and sent to the Legislative Counsel Bureau, and in addition, it's posted on the website for public viewing. And if you submit a patient safety plan with names, we will go in and do our best to redact it, but we cannot guarantee that we will remove all personally identifiable information. So the next part asks about the number of employees. And if you have 25 or greater employees, the expectation is that you will have patient safety meetings monthly and that they will be attendance required with certain roles at your facility expected to attend. Whereas if you have less than 25 employees, you will be expected to have your patient safety meetings quarterly. So in this case, we will put 26, and depending on your answer, the information changes. And the reason I put 26 in is I want everyone to see that with the larger institutions, you're expected to have an infection control officer in addition to a patient safety officer, excuse me, who is your chief medical doctor, who is your chief RN, your pharmacist, the executive member from your administration that attends patient safety meetings, and whether or not you meet at least monthly, and whether or not your mandatory attendance of the meetings. And then we ask for a summary of what you've been doing at your facility. We do not require it, but basically, what did you do different this year than you did last year? Were there any special needs you have? Things like this. And did you have any new innovations? Uh, are there any needs that we could provide? And along that note, the state of Nevada is in the process of securing an external agency to provide professional patient safety webinars geared towards patient safety. Today's webinar is about the Sentinel Events Registry and how to participate in it. The proposed new webinars will be focused solely on implementing patient safety in your facility. And once we have firm dates on that, we'll be sure to let you know. And then what day did you complete it? This is important because the filing period is open till March 1st. We accept filings after that and encourage it, but as far as the statistics go, your facility will be in the count of those who did not meet the immediate need of the timeline. That said, if you don't get it done, just try to get it done as soon as possible. Also, though, approximately mid-May, if you have not filed, it will be not counted in that year's statistics. And nowadays, as everybody is probably aware, the website, excuse me, the internet is dealing with what would be called bad actors. And so we have to take extra security steps and formalize the process. And along that, we now ask for you to put in a representation of your signature or a unique mark. And then you would save and exit. But again, look, I almost did it. You want to click here and go unverified, and then save and exit form. And once you've completed that, you're done. We will not notify you once it's been reviewed, but when it has been reviewed, it will get a green radio button right here. And so that's the process for filing your annual report. The final project that's needed with the Sentinel Events Registry is the facility contact information. And we recognize that staff change and different people come and go at facilities, and facilities close and they open. And in order to stay on top of that, we have the contact form. And so when you first start your facilities accounts with the RedCap and Sentinel Events Registry, you'll be provided a link and it will be already created for you. But we're going to go through today the process of creating a new contact form. And so today's date, and then the facility, Scooby-Doo, plastic surgery, facility's license number. And so this will be an ambulatory surgical center. And you can see here all of the different healthcare facility types expected to report. And again, I'm aware that certain facility types are not, certain facility types because of their nature of being staffing facilities or referral agencies, may feel that this doesn't apply to them. And as I said before, send an email to ser@health.nv.gov explaining why you feel your facility should be either exempt or have limited participation. And so with Scooby-Doo, we're an ambulatory surgical center in this case. And we are in Washoe County. And we ask for the average number of employees per day. And this is kind of just to verify that when you file your annual report, whether you're above or below the 25 reporting requirement, there are no penalties. I know people who have put 25 or 24, and their websites indicate quite a few more employees. We're not going to track that down. We do ask you to be honest. And this facility does not have a previous name, and this facility does not close. And then the patient safety information. Now, the key part here to take away is no person should be entered twice. The patient safety officer is not a designated reporter or an admin. And so the patient safety officer is the only role here required. Now, when we say patient safety officer effective date, that would be the date you sign up here. You may have held that role previously, but as far as reporting requirements, it's the day you've set up your account and completed this form. And then if you have the time when you leave, it would be courteous to put this in here. That said, most do not. And what happens when there's a change of staff at a facility, you would send an email to ser@health.nv.gov or give me a phone call. The office number is 775-684-4112, or the telecommute number 775-560-5582. And we will save this off, and then you will be asked to bring all the information up to current. And so when we say the credentials, that's like your professional designation. In this case, we'll just say RN or technician, or and if you're not a medically trained but are the owner of a facility, just put an owner. And then the staff title, again, or whatever is appropriate. We ask you to enter your email and then a phone number. And there's no formatting, just put in the number. And here's an interesting question. When people sign up, we ask them to read the FAQ, and we ask them to indicate here that they have read it. Nobody checks, but we're asking. And so the program allows for up to 2 additional designated reporters that have data entry rights. And this, for larger facilities, the patient safety officer may be busy and needs someone else to handle entering reports. And that's where we allow 2 additional accounts for that purpose. And that's where this information here would go. The program also offers one admin role, and this is a read only. And this would be like a CEO or somebody in that capacity who would have a need to kind of check on it, but not in a role where they would be entering information. And so when you're finished, again, you would put it to here as unverified and save and exit. So now we've gone over the various 3 projects that are required for reporting the Sentinel Events Registry. And I'm going to briefly cover what happens when you want to create an account. You will send an email to the Sentinel Events Registry asking for a new account, and then you will be given a link to a survey form, and we're going to go there very quickly. And this is the new user agreement survey. And we are going to add a new one and just kind of walk through it. This is the information you will need to create a new account. And when you go here, you may or may not see it exactly as this. It's subject to change at any time. And this is a result of the bad actors out on the internet and the need to formalize our security policies and the processes that we implement with the program. So you would enter your first name, last name, and then how you would like to be addressed, and then your role, the phone number. And we're asking for more information for contacts because many times the account is suspended. And that's another change. If you do not log in within 180 days, your account will be suspended and you will have to ask for it to be unsuspended. And it has not been implemented yet, but it is in the works to require resetting your password on a regular basis. And so we ask for a primary phone number and an alternate phone number and an email. This email will be connected with your account, and we ask that it must be unique to you. It cannot be a generic email to your facility. We are allowing those who already have accounts that do not meet this to be grandfathered in, but going forward, we will require unique emails. And going down here, we ask for a secondary email. It's not required. And your role. We've already covered these. So we have patient safety officer, designated reporter 1 or 2, and administrator. And then your organization license number, which can be gathered from a TheaNet, and I will post in the chat the link to that facility, that website, if you don't know it and need to look it up. Or conversely, you can send an email to us or call me and we can look it up for you. And then what kind of license is it? And no need to type it in. You can just pick from the list here. And then we ask, what is the name on the front of the business? We understand that there are differences in the names between a business and the doing business as, but if somebody were to come in your front door, what is the name of your business? And then if you have a website, then the state you're in, and if you're like a remote administrator in a different state or something, you would put the appropriate state where you're located. And then if you represent a department, and this is an interesting part, authorization. If I'm contacted by somebody asking for a account, we need to know that that's an approved exercise or operation of your facility. And so we're asking that you enter this. And we also, though, recognize that there are many facilities that are small. And so go ahead and put here if you're the owner operator. But if you are, just enter your own name in these fields. And once that's completed, you will come down here and you don't have to change this. It's up to you just by doing the save and exit. this will be entered in our database, and we ask that you send a email to ser@health.nv.gov indicating you've completed this, and we will do our best within 10 days to have your account set up. When that happens, you will receive an email to set up your password. And once you've set up your password, you will go and log in. And as you can see, this takes a while. Somebody has unmuted themselves. Would you please mute? So I believe I've covered most of the areas of the program. I'm going to go and get the please bear with me. It's in a delay. I'm going to stop presenting at this point. Okay, with that, I will now look in the chat section and attempt to answer your questions after I paste the link to the licensing website. Okay, so let me scroll up and look at the questions. Okay. First question, do PC agencies have to send reports? Okay. Currently, the NRS says that if you feel that that is not applicable to your facility, I ask you to send an email to ser@health.nv.gov explaining why that doesn't make sense, particularly if you deploy workers to a setting that is already reporting. And that will be used when we have a discussion around developing administrative code to address um, special situations like that. Okay, I see another request about where to send information if you feel that your facility type should not be included. And I'm going to type that in the chat window here. Okay, I've posted that in the chat. Um, uh, so the next question I see here is regarding faxing self-report to the state. Um, Faxing, as far as the Sentinel Events Registry, has not been used since 2016. Um, and the RedCap platform is the method of notifying the state of a Sentinel event. I cannot speak to other programs, and other programs may require faxing of information. I can only speak to the Sentinel Events Registry. Where was that safety form? Okay, the safety form, when we first started, I posted a link to the program. If you go to that link and look to the right-hand side, there is an area that says forms. Click in there and look at the number of forms available, one of which is a patient safety template. Is there a recommended agenda for patient safety meetings? No, there is not. Having been in a setting where safety meetings are held, generally they ask if anybody has to report anything that was either a near miss or a real need, and then somebody gets up and talks about some aspect of patient safety. There is no requirements. Um, that is left up to the facilities to determine. Next question. If we are just starting these reports now, are we required to submit an annual report for 2021? No, you are not. I ask if you have been doing patient safety and have that information, you're more than welcome to file. But if you're just entering the program, we are not asking or requiring, excuse me, we're not requiring that you file an annual report for the previous year. Next question. We need to complete one for 2020 or 22? Okay, so right now the reporting window is from January 1st to March 31st, and that window is reporting for events that occurred in 2021. Will there others to help with this report? Will this be reported? Yes, this webinar is being recorded, and I am available for one-on-one help at any time. I do ask that we kind of share our calendars in a sense, that we arrive at a time that's good for both of us. But I am definitely available to help one-on-one. We're here to help. This is a proactive program. We are not punitive. We want to see facilities become aware of patient safety and to essentially do the right thing. So as far as that goes, if you need help or want to go over any aspect, don't hesitate and we will set up a one-on-one help session. Oh, for revised precipitation was the email. So it's ser@health.nv.gov, and I believe I pasted that already. Next question. If the site has less than 25 paid employees per day, then quarterly meetings are required. Yes, that is my understanding of the NRS. What are the 3 forms that need to be filled out? Okay, so I think the term forms should be called projects. And so the 3 projects are the event reporting, which has 2 forms, the annual summary report, which has 1 form, and the contact project, which has 1 form. The event project, you may visit it often or you may not visit it at all. The annual report will be visited once a year, and the contact form will be visited upon initiation of reporting at any time there is a change in staff. Okay, next question. Since you want the DBA, what if a business is a franchise and where there will be more than one with the same name? Okay, I would recommend putting the franchise name followed by the name of the city or the location or the street somehow that distinguishes it from other franchises. When a participant belongs to an RFFG and also in hospice, who files a Sentinel events report? Very good question. Currently, we require one account per facility. We are investigating how to address that so that one account can report to more than one facility. But at this time, we have to have one account per facility. And hopefully that will be resolved here within a month and we can make changes in the new accounts. We can allow them to report for more than one facility. Okay, next question. As a PCA agency, are we only reporting events we witness? Does this affect serious occurrence reports agencies with Medicaid contracts have to file? Okay, to kind of back up a second, the Sentinel Events Registry is standalone. It's the state of Nevada's program, and we do not interact with any federal programs, nor do we interact with Healthcare Quality Compliance Bureau as far as their roles for site investigations, complaint investigations, etc. That is not this program. And on that note, every piece of information submitted here is not discoverable by, not discoverable by court and is privileged and private. So the other part of this question, do we only report events we witness? Uh, that is, I cannot say for sure. So one of the things is, has somebody expired while a patient or within 24 hours? I'm assuming that may not be witnessed. But if it's in your facility or in a facility you're deployed in and you're expected to report, I would think you would, but that is an area that is left up to the facilities to determine. Do residential facilities for groups 100 plus units need to do a report? The annual Sentinel events report, yes. All facilities, regardless of type, are expected to file the annual summary report, regardless of beds or units or whether people stay there more than 8 or 24 hours. Oh, why I would think that some facilities may have limited or no involvement. And the idea is double reporting. If your facility deploys as a staffing agency an individual in another healthcare facility, that other healthcare facility would already have responsibilities for reporting. Prime examples being nursing pools and some of these others where um, a worker is placed in a different setting. The business has no physical presence. Okay, next question. I have an account already open when COVID hit. I am in the account but cannot find or type any events drop-down box. Okay, you will need to send a message to the SER that you want to participate and that you already have a red cap account, and we will add the new projects to those accounts. Okay, somebody asking that there's too much in the chats and can we summarize all the questions? I will try to do that afterwards and to send that out to everyone, or at least those who, I will try to summarize all the questions and provide that after the webinar. What is the time frame to report an event? Very good. So that's in the Sentinel Events Registry. I'm going to share my screen and we're going to go over to the frequently asked questions real quickly. So up here, under the questions, what important timelines do I need to know? Question 7. So here's the important timelines. So one day, 24 hours, a person who is employed by a healthcare facility after becoming aware of a Sentinel event that has occurred should notify the patient safety officer. 7 days of becoming aware of the facility that the you can see this as well as I can. So one day, 7 days, 13 to 14 days, and that depends on who is notified, and then 45 days in the calendar year. And we are dealing with a delay. And I'm stopping sharing. Okay, next question. Again, I have a red cap account, but I do not see these projects. And just send us a email, and we will get you set up with those additional projects and the rest of the process of enrolling. Okay, next question. For pressure ulcers, how will we know if pressure ulcers PU was reported by hospital or facility prior to coming into setting? If we should not be double reporting, should we assume this was already done? Okay, you're not the first person with this question, and basically, as far as documentation goes, it's up to the facility to record that the condition was present upon admitting. And if it is, then it's not your responsibility to report. That said, if after the fact they've been there, you learn that they have already had this condition prior to their admittance, and you've already filed a report, then you would send an email saying to the effect, we've discovered that this is not the case. These are the new set of circumstances, and we would like it reviewed. What happens then is that is passed up the line to the state of Nevada's chief medical officer, who will review the information and either ask for more information, clarification, and or make a final determination. As a PCS agency, the setting of the services, yes, I believe I've covered that. Um, so if you feel that that's the case, that uh, uh, is why you should be either limited or not involved, send an email to the ser@health.nv.gov explaining why. Um, I see no more questions. I want to thank everybody here, all the healthcare professionals, for your time and dedication to stick this out. And we're available for questions, a proactive program. And at this point, I have nothing further. If you have a question, please type it in. Otherwise, I will let you go and give you your morning back. And thank you.